Happy Thursday, Weight and Gold community. Welcome to the Weight and Gold YouTube series. And we're talking about medications. And if you've been following along, you already know that we open this up with a discussion of why you may need medication, how to know, things to consider before starting medication. We did an episode before on phentermine, and now we're going to talk about a drug called Topiramate. So Topiramate is almost like my secret tool in the toolbox, I think. It's an older drug. It's a generic drug. It's been used for a long time to treat conditions like migraines, seizures, anxiety. Some people will even use it for sleep, depending on the person. So it really is one of these medications that have had off-label use for a long time, because off-label is something that's been around for a long time and we treat so many conditions effectively that way. It's just recently gone under scrutiny. But Topiramate's been used for a long time successfully for the treatment of other conditions. Now, I've known, from doing primary care before, we would see patients, like we would give them this medication for seizure disorder, for example, and they lose like 30 pounds in a few months, without a real clear understanding. It was just something we knew that could be a side effect of the drug. But now, because of all the research, thankfully, that's been done on obesity medicine over the last few decades, we now understand why that is, right? So as we talked about a little bit with phentermine, again, I'm not going to get too sciencey, but there's a part of the brain, the hypothalamus, that regulates so much of our weight and our appetite and our drive to eat. And it has these pathways that go to the rest of the body. So there's the anorexigenic pathway and the orexigenic pathway. And the orexigenic pathway essentially kind of sends messages to the rest of the body that, hey, we don't have enough resources, so we need to hold on to the weight that we've got, and we need to go and look for all the snacks and really make sure that's high reward snacks, because we really need to store as much as possible, right? Makes sense that we would need a pathway like that. So Topiramate really just kind of turns that pathway off. Wouldn't that be nice, right? So where I see this medication be really successful as a generic used off-label for weight is a lot of individuals, a lot of us that have like carbohydrate cravings, high interest in carbohydrates and sweets, and it really kind of takes the edge off for that. If we have a lot of night eating behaviors where, throughout the day, you're really able to stick to your nutrition plan, it's not that difficult, but there's something about the nighttime that you really just have all of these desires to eat, or that's where most of your hunger is. It really seems to be very effective for individuals in that situation. And, when we have a binge eating or emotional eating type component, it can be very helpful for that as well. So it's an inexpensive medication. It has some side effect profile, and it's really kind of a nuisance for the most part for most individuals. That it usually doesn't cause any type of life-threatening type side effects. So a few things that we do have to be cautious of with Topiramate is if you are biologically a female and could potentially become pregnant, and you are not actively preventing pregnancy, Topiramate is probably not the best medication for you, because it can cause birth defects, primarily like cleft palate. So it's not a great medication to use if you're welcoming a pregnancy within the next 6 months to a year. And you really should be, I always recommend patients should be actively preventing it. Otherwise, side effects, I'd say about 20 to 30% of people get this kind of, we call it this cognitive slowing or cognitive delay almost. And what it really looks like for most people is this like, what did I come in the room for kind of thing, or like, what's that word? So it can be a little annoying if people get that and notice that. But there's a large amount of people that don't experience that at all, which it works well for them. It usually doesn't cause any type of true cognitive delay in terms of like not knowing how to drive your car anymore, or not knowing how to carry out tasks, right? So if it shows up for individuals, usually it's kind of an annoying thing. And if it interferes with your quality of life, we stop the medication. I often share with a lot of my patients, I was very briefly on Topiramate years ago for migraine prevention, because I used to have really terrible migraines when my weight was higher, because migraines can be a secondary condition from obesity. And now that my weight's healthier, as an aside, like I don't really have to deal with those anymore, which has been wonderful. But I personally was on Topiramate years ago to regulate my migraines, and I could only be on it for like a month, 4 to 6 weeks. I was on the lowest dose, and trying to walk around and be a doctor, and I was like, what was the name of that medicine? What was the name of that thing? Oh, I don't remember that lab. And so very quickly I was like, yes, I know I'm not actually losing information. I can remember it within 20 to 30 seconds, but it really made me feel uncomfortable and not as confident as I needed to be with my interactions with patients and practicing as a physician. So it was something I definitely didn't continue. So that's kind of my real world example of what someone might feel with Topiramate if they get those side effects. And again, only about 25 to 30% do. Another one that people may notice, numbness and tingling. It can be hands, feet, through areas through the face. It's not going to get worse necessarily. It's not going to harm you. It's usually the body getting used to the medicine. It usually fades away in 1 to 2 weeks. And for a lot of patients, if they take like a third cup of lemon or lime juice with a glass of water every day, it seems to kind of balance that out and go away. So it's a nuisance. It's not anything that keeps most people from being able to take the medication. Another big thing to consider with Topiramate is if you have history of kidney stones, so it may increase your risk of having kidney stones again, even if you drink lots of water. So if you've had a lot of kidney stones, this may not be the best medication for you. So just a few things to consider, because a lot of these medications can be very effective in the right patient when we select it well. So real quick review, right? So can be very helpful with reducing our appetite, reducing our food-seeking behavior, reduces our interest in sugary beverages and carbs, really helpful for night eating and maybe even some binge eating. It's an affordable medication. There are some side effects that we have to keep in mind if it's the right selection for someone. But as with anything, this is not medical advice. This is information only. And if you work with an obesity medicine provider to review your history and have a good risk-benefit discussion, this potentially could be a great option for you to help you treat your disease. So Topiramate, option number 2. Phentermine, we discussed in the video before, option number 1. And we'll keep moving forward. I hope you follow along. So for our next drug next week, we're going to talk about the bupropion naltrexone combination, also known as Contrave. So please subscribe, follow along, because you don't want to miss this information.